Chapter 13, Physical Assessment. List 4 purposes of a physical assessment. Name 4 assessment techniques. List at least 5 items needed when performing a basic physical assessment. Discuss at least 3 criteria for an appropriate assessment environment. Identify at least 5 assessments that can be obtained during the initial survey of clients. State 2 reasons for draping clients. Differentiate a head-to-toe and a body systems approach to physical assessment. List 6 ways in which the body may be divided for organizing data collection. And identify 2 self-examinations that nurses should teach their adult clients. Is the following statement true or false? The first step of the nursing process is planning. False. The first step of the nursing process is assessment. Physical assessment. It is one method for gathering health data, and it's a systemic examination of the body structures. Purposes of physical assessment: to evaluate the client's current physical condition, to detect early signs of health problems, to establish baseline for future comparisons, to evaluate clients' responses to medical and nursing interventions, also gerontological considerations, and physical limitations for chronic disease. The first step in assessment is inspection. You need to examine particular body parts. You're looking for specific normal and abnormal characteristics. You're using special instruments to inspect parts of the body inaccessible to ordinary and visual inspection techniques. Next is percussion under assessment. This is striking or tapping the body with fingertips to produce vibratory sounds. Quality of sounds determines location, size, and density of underlying structures. Variation in sound could mean possible pathological changes. Pain indicates possible disease process or tissue injury. Percussion sounds. There's muted, thud, empty, cavernous, and booming. Muted is soft, flat, and usually occurs over muscle or bone. Thud is soft to moderate. It is a dull sound, and then it's heard over the liver, full bladder, and tumorous masses. An empty sound can be moderate to loud, it's resonant, and it's usually over a normal lung. A cavernous sound is loud, it's tympanic, and it's usually an intestine filled with air. Booming is very loud, hyperresonant, and barrel-shaped chest overfloated with trapped air is usually when you can hear it as a result of chronic lung disease. Auscultation is your 4th step. This is used for assessing the heart, lungs, and abdomen. You can distinguish between soft sounds and loud sounds. Nurses practice auscultation repeatedly to gain proficiency, to ensure accuracy, and to eliminate or reduce environmental noise. What is lightly touching or applying pressure to the body using fingertips, back of the hand, or palm of the hand called? Is it inspection, percussion, palpation, or auscultation? It is C, palpation. This involves lightly applying pressure to the body using fingertips, back of the hand, or palm. Inspection is looking for specific normal and abnormal characteristics. Percussion is striking or tapping the body with fingertips to produce vibratory sounds. And auscultation is listening to the sound of the heart, lungs, and abdomen with a stethoscope. First, you should always do hand hygiene. Identify the patient with 2 methods, and introduce yourself, and also provide privacy. So drape and position the client. Ensure that the client is covered with a drape, and begin examination with the client standing or sitting. Select a systematic approach for collecting your data. There's several different ways. There's a head-to-toe approach, a body systems approach, and some people have an integration of parts of each. The head-to-toe approach advantages is it prevents overlooking some aspect of data collection. It reduces the number of position changes required of the client, and it takes less time because the nurse is not constantly moving around the client in what may appear to be a haphazard manner. The body systems approach advantages is clustered findings. Disadvantages: the nurse examines the same area several times and frequent position changes are required of the patient. Examining the client, outline the procedure for performing a physical assessment. Head and neck. You're going to assess the mental status, the eyes, accommodation. Use the Snellen eye chart for vision, the Jaeger chart for color. Test for extraocular movements. The ears, you're checking for cerumen, which is wax. You're going to also use the Weber test. With the tuning fork, the nurse strikes the tuning fork on his or her palm and places the vibrating stem in the center of the client's head. The sound is equally audible in both ears, if it's normal. The Rhine test is when the nurse strikes the tuning fork and places the stem on the client's mastoid area behind the ear. The client reports when the sound stops. The nurse moves the tines of the still vibrating tuning fork near the ear canal and asks the client if he or she perceives the sound. Sound is heard longer by air conduction. That's a normal result. Also, you can have audiometry, which are the hearing tests. Nose, check for abnormalities and also smelling acuity. When preparing a client for the Rhine test, which of the following equipment should the nurse keep ready? Is it a stethoscope, a tuning fork, a Snellen chart, or a Jaeger chart? For head and neck. Also with head and neck, you're going to check mouth and oral mucous membranes for unusual breath odors and assessment of taste. In addition to it, you check for moist, pinkish membranes. Facial skin, you're checking alterations in skin. Checking hair and scalp for abnormalities of any scabies or lice or dry scalp, and condition of hair, and then you're going to check the neck. Here are some common skin lesions listed on the left side of this slide. On page 243 in TIMBY Fundamentals, you can see this better. They have examples of macules, papules, vesicles, wheals, pustules, and nodules, and cysts. So the first one is a macule, which is flat, round, colored, non-palpable area that you could see on the skin. The next one is a papule, which is otherwise known as a wart. Okay, the first one is actually, macule is actually freckles. So the second one is a wart, which is the papule. The third one is a vesicle, which is a blister. The fourth one is a wheal, which is a hive. The fifth one is a pustule, which is a boil. The sixth one is a nodule, which is an enlarged lymph node. And the last one is a cyst, which indicates some tissue growth underneath the skin. Next is chest and spine. You're going to inspect for skin turgor by pinching up just under the collarbone to see if it tenses. If it tenses and doesn't go back right away, that's a sign of dehydration. Also, you want to assess chest shape and movement and chest expansion, making sure it's equal and full. Also check the spine for lordosis, kyphosis, and scoliosis, and also the breasts to see if they have had any surgeries, there's any scarring, there's symmetry, anything abnormal. And then heart sounds are checked last in the chest and spine, S1, S2, S3, S4. Then you're going to check lung sounds. Normal lung sounds are tracheal, bronchial, bronchovesicular, and vesicular sounds. Adventitious lung sounds means abnormal are crackles, gurgles, wheezes, and rubs. Also, you can percuss and feel tactile fremitus on exam. And you should also be listening to lung sounds every time you check your patient for an assessment. Which sound is not a normal lung sound? Tracheal, bronchial, vesicular, or wheezing? Wheezing is an adventitious abnormal lung sound. It is not normal. Tracheal sounds, bronchial sounds, and vesicular sounds are normal lung sounds. Extremities, you're going to assess cap refill at the nail beds, also color, muscle strength. You're going to check fingernails and toenails, condition, shape, edema, measurement, and what type, 0 to 4. Also skin sensation, is it numb, tingling, painful, especially at the extremities. Abdomen, checking bowel sounds for hyperactive, hypoactive, and absence of. With abdomen, you start with inspection first and then go immediately to auscultation. Then you can do your percussion and palpation. In some cases, you're going to do an abdominal girth measurement, and also you want to inspect the genitalia every time you assess your patient. Anus and rectum, you need to position the client accurately so you can see. You're looking for trauma and hemorrhoids and any kind of infection or drainage. Self-examinations can be taught, breast and testicular. These are in your book. And you just finished with your head-to-toe exam. This is the end of the slideshow.